Dr. Jen is in Boston, and we have our questions from our viewers asking Dr. Jen, what should I do if I start developing a side effect from a medication?
Okay, great question. So first of all, before you start a new medication or a supplement, anything over the counter for that matter, you want to have a general idea about what types of side effects are possible and how often or common they are. Remember, if you looked at something like acetaminophen or Tylenol, there's a very long list. That doesn't mean that's going to happen. And then you want to track your symptoms, again, assuming that they're mild and not severe. Keep in touch with your pharmacist, your healthcare provider who prescribed or dispensed that medication. Never discontinue abruptly a prescription medication, one that is urgent, without communicating with your doctor or healthcare provider. And remember that some side effects are mild, and it's just a matter of your body kind of adjusting to them. And remember, some can actually be a coincidence and have nothing to do with that medication. I hear that as a practicing physician all the time from patients.
It's good to remember. Your prescription for wellness.
Okay, has to do with varicose veins. Now, some mini med school on this. These are the rope-like thick veins that often can occur in the lower extremities in women as well as in men. Most of the time they have a strong genetic component, but there's also behavioral modifications, things that we can do to lessen our risk for developing varicose veins. People who walk a lot know this very well, like nurses and doctors, and work on their feet. So avoid high heels and tight pantyhose or socks. I like those graduated compression garments. Those are really good. Change your position often. Go from sitting to standing as often as you can, especially if you have to sit for your job. And then what we eat. Eating a high fiber, low salt diet potentially can lower the risk, as well as exercising and keeping your weight in a healthy range. Those are all really important. If you do get them, you guys, vascular surgeons can do something called a stripping procedure, but these are different than those spider veins, which are flat and really just very, very superficial.
You talk about ways we can prevent them. Are there ways that we can treat them?
Yeah, I mean, listen, if you're really bothered, because they can not only be unsightly, they can also cause some discomfort. Vascular surgeons are the ones that deal with this all the time, try to get a consultation, but they can do a minor surgical procedure that actually removes them.
All right, Dr. Jen, thank you. And folks, we want to hear from you. You can send us your questions to us on Instagram at ABCGMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.